In the Brooklyn Museum sits a papyrus scroll, copied around 450 BCE from material that may date back nearly 2,000 years earlier. It is not a religious text or a story. It is a clinical manual, listing specific species of snake by their appearance, describing the exact symptoms each bite produces, and prescribing a specific treatment for each one. For some bites, the papyrus is blunt in a way that still feels startling today. It states plainly that the victim will die, and that no treatment should be attempted at all. No comfort. No hope offered where none existed. Just a clear, documented prognosis, written down for the next physician who would eventually face the exact same bite on a different patient. This is the Brooklyn Papyrus, the oldest known medical document dedicated entirely to snakebite, and it proves that ancient physicians were not guessing. They were running a documented, repeatable diagnostic system, thousands of years before anyone understood what venom actually was. Imagine walking through tall grass with bare feet, no boots, no phone to call for help, and feeling a sudden sharp pain followed by spreading heat and numbness. No ambulance coming. No hospital nearby. Just you, the bite, and whatever knowledge your community had managed to gather across generations of exactly this same emergency. You would have had seconds to decide what to do, and centuries of accumulated knowledge, some of it genuinely useful and some of it completely wrong, waiting to guide that decision. The honest question is not whether ancient humans feared snakes. The real question is what they actually did in that exact moment, and how much of it, tested against everything modern toxicology now understands, actually worked. Most of what we know comes from three overlapping types of evidence. Ancient medical texts, some remarkably systematic, describing symptoms and treatments in detail specific enough to identify the snake species being discussed. Toxicology research, which can test old remedies directly against real venom in a laboratory setting to determine whether they had any genuine biochemical effect. Ethnobotanical fieldwork, documenting traditional remedies still in use today, some of which pharmaceutical researchers are now studying specifically because they contain genuinely active compounds nobody has fully catalogued yet. Egypt's approach, preserved in the Brooklyn Papyrus, was built entirely around triage. The text divides bites into categories based on likely outcome, some described as survivable with intervention, others marked clearly as fatal regardless of treatment. For the survivable cases, prescribed treatments included incision at the bite site to encourage bleeding, application of specific mineral and plant-based poultices, and close monitoring of symptoms as they progressed. This was not superstition dressed up as medicine. It was an early form of clinical prognosis, sorting patients by severity in a way that would look familiar to any modern emergency room. Built centuries before Egypt even had a formal word for medicine as its own separate discipline. The physician reading that papyrus was not performing a ritual. They were consulting a reference document, cross-checking a patient's symptoms against a known list, and making a decision based on precedent rather than instinct alone. The papyrus even describes snakes by physical markings, color patterns, and behavior, essentially an early field guide built specifically for emergency diagnosis rather than casual natural history. A physician who could correctly match a description to the actual snake responsible gained real, practical information about how quickly a patient needed treatment and how aggressive that treatment needed to be. Greece and Rome produced their own detailed literature, and one figure took the problem to an almost obsessive extreme. Mithridates VI, king of Pontus in the 1st century BCE, was reportedly so afraid of being poisoned by his own rivals that he began deliberately consuming small, carefully measured doses of various toxins, including snake venom, attempting to build up a tolerance through repeated controlled exposure. He did not stop at venom alone. Ancient sources describe him testing his growing tolerance against a wide range of poisons, adjusting doses over years, treating his own body as a long-running experiment nobody else in his court would have dared attempt. His personal formula, later known as Mithridatium, combined dozens of ingredients and became one of the most famous supposed universal antidotes in the ancient world, remaining in use in various reformulated versions for well over 1,000 years after his death. Physicians across multiple later empires kept prescribing versions of his formula, long after anyone remembered exactly why it was supposed to work. Whether it actually protected him from poison is impossible to know for certain, but the underlying instinct behind it, that controlled exposure to a toxin might train the body to resist it, was not entirely wrong. Legend even holds that when Mithridates finally tried to poison himself rather than be captured by his enemies, the poison failed to kill him, and he had to ask a soldier to end his life by the sword instead. True or exaggerated, the story became inseparable from the reputation his lifelong experiment had already built. The physician and poet Nicander of Colophon, writing slightly earlier, produced an entire epic poem called the Thyriaca, cataloging venomous creatures across the known world alongside detailed treatment instructions for each one. Turning a medical reference text into poetry was not decoration. In a world without cheap paper or printing, verse was easier to memorize and pass down accurately than plain prose, meaning Nicander's poem functioned as a portable, memorizable emergency manual disguised as literature. A traveling physician, or even an ordinary shepherd working alone in snake country, could recite the relevant verse from memory the moment a bite happened, with no scroll required at all. India's medical tradition, recorded in the Sushruta Samhita, approached snakebite with equal seriousness and considerable surgical detail. The text describes classifying snakes by type, applying tourniquets above the bite to slow the spread of venom through the body, and performing careful incisions to drain contaminated blood from the wound. Sushruta also described symptoms progressing in stages, allowing a physician to estimate how much time remained before intervention became useless, an early and surprisingly accurate understanding of how venom actually spreads through human tissue over time. Ancient China developed its own parallel tradition, recorded in early herbal compendiums that catalogued specific plants believed to counteract venom, alongside acupuncture points thought to slow its spread through the body. Traditional Chinese medicine also emphasized rapid movement restriction, keeping a bitten limb as still as possible, based on the correct underlying observation that physical movement accelerates how quickly venom travels through the body. A genuinely accurate piece of practical advice that modern emergency medicine still recommends today almost word for word. How many ancient remedies genuinely slowed the spread of venom, buying a victim enough time to reach real help? How many felt effective simply because most snake bites, even venomous ones, are survivable without any treatment at all? How many desperate patients credited a remedy for recovery their own body would have managed regardless? Across parts of Africa, indigenous healing traditions developed detailed plant-based treatments passed down through oral knowledge rather than written text, some specifically targeting swelling and pain rather than attempting to neutralize venom directly. Healers often specialized specifically in venomous bites, a recognized role within the community distinct from general medicine. Called on urgently and treated with the kind of respect reserved for anyone whose skill genuinely meant the difference between life and death. Modern pharmaceutical researchers have begun formally studying several of these traditional remedies, and a genuine number of them contain compounds with measurable anti-inflammatory or mild anticoagulant properties. Meaning some of this knowledge was doing real biochemical work, even though nobody involved could have explained the mechanism at the time. Not everything ancient cultures tried actually worked, and the honest version of this story has to include the failures alongside the successes. The cut and suck method, slicing open a bite wound and attempting to suck venom out by mouth, appears across an enormous range of cultures and persisted well into the 20th century in some regions, even showing up in wilderness survival guides sold to the general public. Modern toxicology has confirmed it does almost nothing useful. Venom spreads through the lymphatic system far too quickly for suction to remove a meaningful amount, often less than a tiny fraction of the total dose. And the open incision itself introduces a genuine risk of infection on top of the original bite, sometimes turning a survivable bite into a genuinely dangerous wound through the treatment alone. Tourniquets applied too tightly or left in place too long could restrict blood flow so severely that they caused tissue death in the limb, sometimes resulting in a far worse outcome than the venom alone would have produced. A tourniquet left in place for hours while a victim traveled to help could mean trading a treatable bite for an amputated limb. a trade nobody intended to make and few understood they were risking at the time. Snake stones, porous objects believed across many cultures to draw poison directly out of a wound when pressed against it, have been tested repeatedly in modern laboratories and shown to have no meaningful effect on venom absorption whatsoever. They simply do not work, no matter how convincingly a healer pressed one against a wound or how firmly a community believed in its power. None of this makes ancient healers foolish. It makes them exactly what every generation of medicine has been, working with the best available evidence, some of it correct and some of it confidently, understandably wrong. Compare all of this to how a venomous snakebite is treated today. Antivenom, the actual modern solution, works through a process that would have sounded like magic to Mithridates, and yet shares a strange conceptual thread with exactly what he was attempting. Modern antivenom is produced by injecting small, carefully controlled doses of venom into a host animal, typically a horse or sheep, allowing that animal's immune system to develop specific antibodies in response over a period of weeks or months. Those antibodies are then extracted from the animal's blood, purified in a laboratory, and used to treat human bite victims, directly neutralizing the venom's effects within the bloodstream once administered. The process is precise, tested, and dosed with an accuracy no ancient physician could have dreamed of, but the core principle underneath it, deliberately exposing a living system to venom in order to generate a protective response, is not far removed from the instinct Mithridates was chasing 2,000 years earlier. He was testing the idea on the wrong species, using the wrong method, with no way to measure or verify what was actually happening inside his own body. But the underlying logic he stumbled toward by trial and paranoid error, that a body deliberately exposed to a toxin can learn to defend against it, turned out to be one of the most important principles in the entire history of medicine, eventually extending far beyond snakebite into vaccination itself. Modern medicine's actual first aid advice for a venomous bite is almost disarmingly simple compared to everything that came before it. Keep the victim calm. Immobilize the bitten limb completely. Get to real medical care as quickly as possible, without cutting, sucking, freezing, or applying a tight tourniquet along the way. No dramatic intervention. No ritual. Just speed, stillness, and trained antivenom waiting at the other end of the journey. That simplicity is itself the end point of everything described in this video. Thousands of years of trial, error, obsession, and occasional genuine insight, slowly stripping away every remedy that felt right but did nothing, until only the interventions that actually worked were left standing. If any of this changed how you think about that old cut and suck advice, that is exactly the kind of correction this channel exists to make, and subscribing means the next one finds you too. Back to that scroll in the Brooklyn Museum. The physician who wrote it, or copied it from an even older source now lost entirely, was not working from fear or superstition. They were running triage, sorting real patients into categories of hope and no hope, using the only tool available to sharpen that judgment, careful repeated observation passed forward across generations. Some of what they prescribed has since been proven wrong. Cutting did not save anyone. Sucking did nothing at all. But buried inside instincts about controlled exposure and immune response, in a paranoid king testing poison on himself one dose at a time, was an idea medicine would not fully understand for another 2,000 years. The scroll survived. So in a strange and roundabout way did the guess hidden inside it.